if you're thinking health is just what goes on inside the hospitals, I'd invite you to think again. Variety of research, time and time again, but particularly recently, as reinforced by Sir Michael Marmot and czars like him, suggests that only 20% of our health and well-being is determined by what actually goes on within the four walls of a hospital or a GP practice. The rest is actually determined by our own, well, the wider culture and also the way we live our lives in general. So where we live, our housing, our access to green space, our own habits, and our mental health, all of that, and particularly workplaces, all of that play an important role in our in keeping us really healthy and well. And indeed, when we do fall poorly, absolutely, we have a fantastic jewel in our society, that is the NHS and indeed our social care system. So health is much broader than what we may think, and that I would invite you to think about that in that way when it comes to data. Now, what is data? Data, we could do a PhD thesis on this. Data is pieces of information in snapshots of time, but that doesn't on its own is of any use if it's not turned into information, knowledge, and indeed contributing to the understanding of both the individuals, but also services that we've got in Lancashire and beyond. And that means it's not just numbers. It's stories that data can help us tell. It's people's feelings that data can help us capture. But also it's not at an individual level as well. We are increasingly entering into the zone of how do we use data from the environment, like the humidity, the temperature, the rainfall even, and as well as what hazards are there in our environment in keeping people safe in their own homes from, say, tripping over, or if they have fallen, ways of accessing help immediately. Now, that is data. Data needs to be turned into information. Information needs to be turned into knowledge, and knowledge needs to be put into action. And that's where the innovation comes in. We have had data and knowledge and information on a range of things before, but I would argue that either they have not been put to use when and where it's collected, and also it's not been accessible to people who need to have that data. And I would argue each and every one of us should have access to our data. Now that the mobile phone technology and access interoperability mechanisms that we've got enables us to enter into that zone of innovation where we can really sweat the possibilities of technology for keeping ourselves healthy and well. And that's what we've experienced during the pandemic. Strangely enough, I just want to acknowledge all the losses that we've endured. And at the same time, it has helped us break through into thinking differently, thinking beyond what we've normally done, because everything we took for granted was basically at risk. So a couple of examples on how we cared for clinically extremely vulnerable people by sharing data near real time, and put them to use to actually care for real people and not just, put bars and charts and manage performance. And likewise, how we've used data to segment people based on their needs at a population level as well. So we are entering a program of work in our ICS, Integrated Care System, across Lancashire and South Cumbria, but this is happening up and down the country. And Lancashire has a very rich culture of innovation, hard work, and renovation and revolution. And we are stepping into a zone of a well-being revolution with which data has got a central role to play. So that's how I see this, and that's how I've experienced it. And it's great to have tech workforce capability being built in our own system. And I'd invite Sam to come in now, please, Sam, and tell us a bit more about the work that you're doing.
Yeah, I really enjoyed listening to you there, Sakthi. It's really lovely to hear you speak. I think what you said there about real-time aspects of data, that is something that striking a particular chord with me at the moment. Like I mentioned earlier, I'm part of the HTE Digital Futures secondment team. So it's myself, Dr. Heather Catt, and Dr. Yona Sykoffer as well. The three of us are being coached by colleagues at HTE and Yale to look at the needs of the population in terms of what the clinical workforce actually needs to deliver the digital future. And I think looking through a clinician's eyes, I can just really see the importance of real-time data. So things like use of you know, the HoloLens, use of communication like Microsoft Teams, things that you can see how clients are managing in their own environments. You can communicate that to the multidisciplinary team in real time using the technologies that we have, rather than sending an email and waiting for a considerable length of time excuse me, before a clinician's got access to a computer. So I think it's that we see data in terms of clinical reasoning. So data to us, like you say, holds that client's history, that client's story. There's a lot of qualitative data there that is incredibly meaningful and incredibly valuable. And I'd argue at times more valuable than like you say, some quantitative aspects of data collection. In terms of real-time, you know, really capturing that information, I'm aware of colleagues across the patch now actually using HoloLenses in terms of trying to increase placement capacity. So we have colleagues at Royal Preston Hospital, we have colleagues at East Lancs as well, working on HTE pilots, actually looking at how to use you know, this real-time data in action for clinicians to help for the purpose of education. I think we all have this in common, don't we? We're all in this current, even though it's kind of a current state of flux at the moment, it's a fabulous time in terms of innovation and creativity, because we're still coming across situations that we've never come across before. So it's to me, it's just even more important to increase those communication mechanisms where we can actually connect clinicians with engineers, with innovators, with companies, to be able to develop what is needed for our client group. Dan, I don't know what you think about that.
quite nicely placed, Sam, there, because this space of innovation really requires people who are either living their experiences or delivering care, but also the knowledge bearers or people who create new knowledge from the academic sector, with working with people in the service industry, but also the marketplace and the tech industry itself. I think this is a real opportunity, and I can see this having applications in all sorts of ways, from individual to the whole of the society, and it ultimately empowers people to take action that's meaningful for them and in a good time. So Tom, please do come in and highlight some of the work that you're doing for our guests.
Yeah, thanks, Sakthi. I think, I mean, kind of picking up on some of the points there, very similar thoughts when I was kind of musing last night. I think one of the things we often find in across the healthcare spectrum is that data is held in multiple disparate sources. It's held in lots of different places from all those organisations that we all interact with day to day. You know, that there is a touch point of data that's collected, but actually it's about how you collate that data, bring it together to create a really rich picture of the patient at the centre, and what you do with that data that's important. But even to the effect that, you know, as you mentioned, Sakthi, we're all engaging with our phones and gathering data in different ways, and there is this kind of move to empowerment of people understanding their healthcare journey a bit more. So for me, it's really important to look at how we consolidate that data across all of those different touch points, and using open standards to be able to store the, you know, normalize the data into a view of a patient, create a longitudinal healthcare record across the whole spectrum, from primary care to community, into mental health, into all those services that we might touch, but also patient-entered data, or remote wearables, or fall detectors in the home, all those things that have actually become quite prevalent and been expedited during the pandemic over the past 18 months. And creating that longitudinal healthcare record is the first step. But actually, I'm really passionately believe that what you do with the data is then the next step. So aggregating data is the first challenge, and you know, we've trod that path a number of times, but allowing clinicians to then engage with the data on the front line, and what does that picture of data tell you at the point at which you're dealing with a patient? So how does that picture of data create a pathway or a plan for a patient in terms of what the next step might be, based on research and outcomes that we've seen previously across the population? Or at a micro level, how do the nuances of change in that data support dealing with a deteriorating or an escalating patient before it's too late? So changes in observations that might come through, and we're working with East Lancashire on observations at the moment. How do changes in that data drive clinicians to act there and then, and to focus resources? So there's a micro view at a kind of frontline level, but then also that data rolls up into the macro view that we've talked about, allowing macro level decisions to be made on a population health management level, to focus resources across the spectrum, and that I had that number 20% on the tip of my tongue as well, Sakthi, because I think actually if you roll up the data, you can start looking at other contributing factors and other wider determinants of health in health data. So you know, social factors, economic factors, all of those other things that actually we know from evidence contribute to outcomes.
No, great. I mean, you really given everything in such a nutshell there. When we talk about data, it really starts from record keeping, and that is also an opportunity for innovation in terms of digital records. But what goes onto the records, in addition to just the numerical physiological measurements of a case, for want of a better word, or a patient, to what their ambitions are, and then that collection and collation and storing, and then that obviously happens in different parts of various services in an organization, various organizations, and then orchestrating that, and then visualizing that as in different ways so that it's meaningful, and then actually using that insight to actually bring about change for an individual, as well as, like you said, for the whole population at a macro level. And you also touched on the use of data to allocate resources, and also to argue for right resources in our community. For example, Lancashire is rural in many parts, and that doesn't really help us understand and argue for resources for rurality, for instance. I'd even go from macro to meta, which is, you know, how does the air pollution levels or the pollen levels going, you know, what does it mean in terms of what can we anticipate? So data is not always about looking like in the rear view mirror, but also help anticipate things. And that's the zone that we're really at the foothills of. So you've just opened my eyes to a range of things there, Tom, and Sam as well. You brought it to what it actually means at a practice level. Now we've got about 10 minutes, or slightly more than that, if people want to share their thoughts, ideas, or indeed want to ask questions. I'm going to look at the question and answer part. Question for Sam. Do you think there is scope for HoloLens when looking at groups with health inequalities to increase engagement and widen access? And I'll have another one from Bipin Patel. Sam, do you want to take that one?
Yeah, sure. I think any sort of wearable tech, there's real potential for use by clinicians. Like you're talking there about clients who are living in particularly remote or rural regions. It's getting that real-time data to a clinician to be able to make decisions. So whether it's a family member wearing it, or whether it's the client themselves, to show you actually their view and the things that they're finding difficult or the things that matter to them. I think there is scope to look at that, but equally it brings challenges as well. As we all know, not everyone has Wi-Fi, not everyone has access to the internet, not everybody has a mobile phone. So I think that we need to unpick really assumptions around when we're suggesting the use of digital technologies, or when we're suggesting the use of data, whether it's clients accessing their own data, or whether we're creating data for use to help clients. I think we still need to look at the end user and think, well, how are they going to use it? So if a family member or a client is using this wearable technology, then are we going to be providing free Wi-Fi? Or, where's our responsibilities in terms of addressing those barriers to health?
Very true, Sam. Yeah, you've really touched on the need for wider infrastructure, and nobody should be left behind with the digital tech. And that again is an ambition that is shared by a lot of colleagues, particularly working in the health and care sector. But this is beyond just the NHS and social care, and this is where we could have a real shared ambition and a vision for Lancashire, dare I say, to be the Silicon County. Bipin has asked a couple of questions. What real examples and step changes made? Can you share that this knowledge is being applied, and how this has had an impact in the health sector? And how does interpretation of this data relate to diversity within communities? Great questions, Bip. I'll take the latter one first. In terms of interpretation of the data, I can give you a live example of COVID response and how we've used data on how COVID has impacted on different sections of our community, and taken that to the forum. For example, we have a Black minority ethnic group forum, particularly led by voluntary community and faith sector, to share that, to get perspectives as to how can we actually mobilize our actions. And that's led to things like communicating in culturally appropriate manner and sensitive manner, but also mobilizing resources like a testing hub or a vaccination mobile clinic in areas where the data is taking us. That's a real example. I would say that we are at the foothills of it. There are a number of initiatives happening in different organizations in the health and care sector that are trying to work on this longitudinal record sharing, interoperability, and so on. But I feel that we're just at the foothills of it. Think about Internet of Things and wearable tech, and how that can actually empower people to remain well as access the right help when they need it. So I would say there is a growing momentum, as a growing opportunity for shared investment and innovation, but we really are just at the foothills of it, is what I'd say. Would you agree, Sam?
I think you've answered that really well.
And Tom, would you like to add anything to the questions?
I think you're right, Sakthi. I mean, I think for our engagement in Lancashire, I think we're at the foothills. I think, as you're closer to the micro level with data in the kind of front line, actually there are tangible experiences of delivering significant, with some of our customers outside of the region, delivering significant reductions in cardiac arrests, for example, through capturing electron conservations properly and being able to run a command and control center in a hospital setting. But I think in terms of the broader picture, actually, I think you're right. I think we're at the foothills of being able to collate that data effectively and for those insights to be shared. But there's the capabilities and the technology are evolving so quickly that actually we're blessed with that access to that data to be able to embark on that journey.
Great. There's a couple more questions. One from Nick King. Lancashire could really be a leader as a data savvy county. What do we think about generating trust? Because this has been on occasions controversial issue about whose data and security and all of that. What should we be thinking and doing to generate greater trust in the data? Sam, and then Tom, perhaps.
I think maybe it's to do with, well, obviously I'm going to say education, aren't I? I've been based in a university, but I think it is to do with education, because the type of education that's out there that's accessible to everybody, you have to look at where it is. It's in places like video recordings, it's in places like snippets in the news. So if the narrative across the news and easily accessible information is that there's been a data breach, there's been challenges in terms of patient information's not being kept safe, those messages still stay with clients, don't they? They stay with all of us. We can remember examples of those through things that we've heard and said in the news and in the media. Straight away, what's come to mind is Netflix and The Great Hack. I don't know if, I'm assuming quite a few of the audience have actually seen that. But that for me was a real threshold moment in terms of thinking, actually, where does my social media data go? So if my social media data is going to these places, then where is my personal, my private, my health data going? So I think we need to be doing more clear messages about where our data is going, how it's being used, and how it can be used in a really positive way, like Tom had said earlier.
And what about Tom, from your perspective, how can, and Sam as well, how can universities work better together with the health sector as well? I mean, we've got 4 brilliant universities in our system. If you think about it, what should we be thinking and doing to enable greater collaboration between universities and health sector?
Yeah, I mean, actually, those 4 great universities and colleges are the reason, one of the reasons, apart from our people, that attracted us to Lancashire, Sakthi. So I completely agree. I think actually we've had a few conversations with academic institutions, but I think it's about the first step is creating those really close ties from a couple of angles. First of all, in sharing the breadth of data that organisations, not just like us, but across the spectrum, capture, because data, aids research and ultimately allows us to close that loop into outcomes as well. So being able to do that across ethically and safely across a region is very powerful and aids those organisations. But then I guess also at the front line, it's also about enabling people who are up and coming and will be on the front line in years to come in terms of the health service, allowing them exposure to those tools and working with them on, what do good technology practices look like? How can technology aid my day-to-day role? Because I firmly believe that technology is an enabler for us to provide more with the resource that we have. So I think there's 2 really key angles for me.
And Sam, that's great actually, Tom, to hear that one of the attractions for you has been our institutions and academic institutions, and there is more to come on that one with all sorts of fantastic things happening in our academic institutions. Sam, what do you make of what we might need to do to enable more collaboration between universities?
I think it's about keeping things simple. So for me, it's about speed of communication. I know as a clinician, I had ideas, I had a concept for innovation based on things that I was seeing out in clinical practice. If I could have had a direct dialogue with someone in innovation, with somebody in a company, with educators or with colleagues at universities, perhaps through direct messaging, perhaps through platforms like Microsoft Teams, then it's possible. I might have been part of building something and innovating right from the ground level. So I think there's something to be said for working on the framework of speed of communication across our localities and networking and having consistent networks as well. Forgive me, that's my opinion. It's
no. I think that's an important point, because having worked across the patch, I do think we could do more and better with creating the collaborative space and making it easier and swifter to communicate between us and share ideas, and more of a collaboration and less of a competition in that space, definitely. And Catherine Dobson's asked a question about what do we need to do to sort of shift from being a clinician, professional focused towards a patient or a person, not even a patient, an individual, a person owning that digital agenda. What's your thoughts on that, Sam, and then maybe Tom?
I mean, the clinician, the client, sorry, is at the heart of absolutely everything that we do. There's no better way than to ask them, to actually ask your clients, you know, spend time with them, see what their day's like, see what the challenges that they face, and really work with them in terms of their ideas as well.
To ask people.
Yeah, I just can't. To me, it's just it's simple, really.
Thank you, Sam. Tom?
Yeah, I agree. I mean, I think it probably links back into some of the thoughts I had on Nick's question as well, in terms of transparency. So for being an organisation that you know has the capability to collate data for the benefit of the patient, actually, I think transparency to at the end of the day, we are all patients as well. Transparency of what is happening with that data as it's entered, as it's captured, engaging patients in their healthcare journey through that lens actually empowers and I think hopefully improves outcomes, but also builds that trust as well. So I think it really is about that transparency and I think probably sharing some of the good as well. So you know, Sam mentioned some of the bits on Netflix, but I think also perhaps maybe we need to do more to share the good outcomes that sharing data is providing and improving our communities and our health for people perhaps to engage.
Yeah, well, that's a good point. I mean, in terms of helping people understand the power of data and how it can benefit them, I certainly think there's definitely a need for more, you know, democratizing data. And again, we saw that during COVID, you know, almost every day. Well, it still is happening. What's happening in our communities on COVID is published, but not in every aspect of the health life. And you've just reminded me of Netflix. You've reminded me of other social media platforms that went down like overnight. I'm not checked if it's all back, but that can itself come with the you know, fear of missing out and anxiety if the tech doesn't work in time too. So it's about the balance, isn't it, and not being over reliant on that, and the person being in charge of themselves and the tech that they have got in their hands. That's really wide-ranging questions coming to us. I'll see if there's anything more. AI and IoT. Bip, do you want to come in and ask, or I don't know if you're able to unmute, but Bip's asking, artificial intelligence, Internet of Things can perhaps better guide us. Absolutely, absolutely, Bip. I think that's definitely going to change the way we think about ourselves and how we access services and how we act. Really well made point.
Let me, if you don't mind, I'll add to that, because some of the solutions that you bring forward, and as somebody who's always been dragged into around the table when we talk about diversity, Black and minority ethnics in particular, we find them come to the forefront. There's little or no understanding of their needs and their aspirations or their background. We're fortunate in Lancashire to have people like Sakthi there. And I'm just wondering, the systems that have evolved, and in many times, as much as we applaud them, right, they've been set up historically, and there are natural biases embedded in that because of the structures. How can AI and IoT identify the biases if people like Sakthi and them are not heavily involved in sharing their experience to it? So I'm just wondering, we're becoming very tech-led. There's a massive drive for digitization, but that kind of evolution, that vehicle, is still redundant of some of the personal experiences that our diversity, gender, sexuality, race, right, are still omitted in terms of the carriages that need to inform our direction going forward. So perhaps you can shed a light in terms of how we can correct these biases.
Wow, that's very profound, Pip. I hope, and my expectation is that by making data available and openly accessible, it will shine light on the prejudices and biases, and hopefully just shine light without creating much of a heat within the community. And certainly we can't overlook, and in the excitement of tech, we can't overlook the the biases, the confounders, and also we can't let any section of the community behind in the excitement of tech. I also hope that because of the way that the tech sector is evolving and increasingly getting more and more accessible, this might be a way of bridging those gaps that we perhaps experienced, and will give people the voice and the platform to be heard and to be seen. It does require careful consideration, doesn't it, in any strategies that authorities and even the tech sector itself devices. So yeah, thank you. Really, very grateful for you for bringing that up. Babe. Easily said than done, but it's a very important subject. Thank you. I am conscious of time. We could be talking forever on tech. Dan, if Dan's here, if you want to say any concluding remarks. Otherwise, friends and colleagues, it's been great interacting with you all. Please do feel free to share details in the chat box, and I can see already people exchanging their social media details. Sam, Tom, any concluding words from yourselves before we wrap up?
No, it's been an absolute pleasure. Thank you very much. It's been really, really, really interesting discussion there, and I think it's particularly important, particularly the last couple of comments that have been said there, important for the future innovation that is about to happen. So thanks for letting us be a part of it.
Tom?
Yeah, very similar, Sakthi. Thanks very much for having me on the panel. Been a really interesting discussion.
And thank you from me. Very grateful for the chance to be part of this, and I look forward to connecting up with many, if not all of you, going forward. Dan, over to you, sir.
Thank you, Sakthi. Thanks very much. I mean, that was just an incredible conversation, and I'm sure everyone will agree, topped off by some really interesting questions, particularly Bipin's at the end, which, given the news of how the region is pushing forward with its digital prowess, with big signature national projects in the region, it kind of feels like there's real opportunity now for the Northwest to be a leader in health, digital health, and with people like yourselves on the front line doing all this work. We're just incredibly grateful to you all. So thank you to everybody who's joined the conversation, and hopefully looking forward to a really good afternoon. We have Professor Jim Richards delivering the next session at 1, leading into a real good afternoon of health and discussion here from UCLan. So thanks to you all. These recordings will be after the event on YouTube, so looking forward to getting those up there and sharing them with you in the future. But for now, thanks everybody, and we'll finish the session there.
Thank you, Dan. Thanks all. Take care.
Thanks everyone.